If the regulatory agencies would have done any part of their job, they had the signal when it came to myocarditis. Here's Ron Johnson looking at unredacted emails that he received, and he put together a timeline that happened in 2021 when the shot was rolling out. It should have all ended right there. It didn't, and this is why.
On February 28, 2021, Israeli health officials notified CDC, quote, of large reports of myocarditis, particularly in young people, following the administration of the Pfizer vaccine. Again, that's February 28, 2021, 2.5 months after the emergency use authorization. On April 12th, over a month later, a DoD consultant raises concerns to CDC and FDA officials about their ability to monitor and track cardiac-related adverse events. The consultant notes, quote, if you do not ask, you will not see it. But does that mean it does not exist, unquote. Around the same time, in mid-April 2021, CDC officials discussed safety signals, quote, for myocarditis with mRNA vaccines, based on DoD and Israeli data, but do not take immediate steps to warn the public. From May 17 to May 21, 2021, CDC officials discussed whether to issue a formal health warning called a Health Alert Network message on myocarditis, noting that, quote, providers aren't reporting these cases to VAERS. They knew they weren't. They knew they existed. They knew they weren't reporting them. A couple days later, during a May 24, 2021 vaccine safety meeting, notes show that FDA and CDC officials asked, quote, is VAERS signaling for myocarditis now, question mark, and are told for the age groups 16 to 17 years and 18 to 24 years, yes. Yes, they saw a safety signal in VAERS, yet. From May 25th to May 27th, CDC officials provide up-to-date information on the status of the Han to Pfizer and Moderna representatives. Not to the public, they're warning the injection manufacturers, indicating CDC's preference to keep those companies more informed about vaccine adverse events than the American people.